Good morning, everyone. Thank you for coming to Healthy Living Together, brought to you by MSU Extension, Great Start Collaborative, Community Mental Health, and the Health Department in collaboration with McKenzie Health System. Today's topic is going to be Medicare and Medicaid, and our guest speaker is going to be Louise Blasius. First, we'd like to cover a few housekeeping items. When you entered the webinar, your audio was automatically muted. We will be using the Q&A function at the bottom of your screen to ask questions. And then this event will also be recorded and be included in a follow-up email to you. Louise Blasius is with McKenzie Health System and is our Director of Human and Community Services, and she will be talking today about Medicare and Medicaid. And then shortly after her presentation, we'll be fielding questions. Louise, would you like to take over?
Thank you very much, Nina. That was a wonderful introduction, and I'm so happy to be speaking with everyone today because fall is a very important time of year for health insurance coverage. The time to get covered is now. So open enrollment with Medicare is October 15th through December 7th. That's when you can change your Medicare plan or your drug plan. And every year it's important to for a senior to check their list of medications, and if that's still on their drug provider's formulary. Sometimes drug companies change formularies and they may no longer carry a particular medicine that you really need. So this is the time of year, October 15th through December 7th, that you can change your drug plan without any penalty. And it's a good thing to double check that your medications are still covered by your Medicare Part D or drug plan. When a person first signs up for Medicare, they also tend to sign up for a supplemental plan, a plan that will pick up what your Medicare copays and deductibles don't. It's usually not a good idea to change your supplemental plans, because once you change, then you can be billed at a higher rate for pre-existing conditions. You can also change your Medicare Advantage plans without any harm, and Medicare Advantage plans are the other option for Medicare. So I would like to explain to everybody there are two basic choices when it comes to Medicare. You can choose the original Medicare, and that has 4 parts to it typically. Part A, which is what we understand as the hospital insurance. Part B, which is the outpatient services. And then people sign up for Part D for medication. And then most people like to sign up for a supplemental plan because there are deductibles every 60 days with your original Medicare. Your Part B, which covers outpatients like the emergency room, that only covers 80% of those charges. So a supplemental plan, something that you go out and you buy from an insurance provider, is usually done. Or the other option that is becoming increasingly popular with seniors is to choose a Medicare Advantage plan. Medicare Advantage plan typically rolls into all of its coverages the 4 different parts of original Medicare. An Advantage plan also may have additional benefits to it. Some of them are including dental, vision, and hearing. And Medicare Advantage may or may not come with a premium, because always people continue to pay their Part B premium. And in 2022, that was $170 a month. And that's still paid when you go to an Advantage plan. So you might be able to pick up an Advantage plan without any additional costs, or you may be picking one up with a premium fee because you're adding additional benefits such as vision, dental, or hearing. So those are the first 2 key decisions people have to make is, do they want to stick with the original Medicare and add Part B, a drug plan Part D, and a supplemental plan? Or do they want to sign up with a Medicare Advantage plan and look at getting everything rolled into one program? Now, the Medicare Advantage plans, their open enrollment is January 1st to March 31st. That's when you can switch your Advantage plans if you'd like to do that. And this is also an important time of year for marketplace open enrollment. So if a person isn't old enough for their Medicare and they're not eligible for Medicaid, maybe because they're a 2-income family, but they still need health insurance, they can go to Marketplace, marketplace.gov, and that's available November 1st through January 15th. And that's where people can sign up for insurance, and based on income too, you may even be able to get a income tax credit by signing up for Marketplace. Also, people may be eligible for help paying for their Medicare drug plan. If a person is single and they're making less than $20,385 and they have less than $15,510 in liquid assets and savings in the bank, they could be eligible for Medicaid to help pay for their drug plan. If they're married, if a couple is married, if they're making less than $27,465 and have less than $30,950 in liquid assets, they too could get assistance paying for their Medicare drug plan. And that's a good thing to know. These programs, that the extra help for people who have Medicare, have different names. If a single person is simply making less than $1,133 and has less than $2,000 in the bank, they're automatically straight up Medicaid eligible on top of their Medicare. If they're married, they could be making up to $1,526 and still be Medicaid eligible if their savings, their liquid assets is less than $3,000. These programs continue all the way up to a possible maximum income of $1,831 for a married couple who had less than $11,960 in liquid assets. So it's important to know that you can get help with your prescription premium and also in your co-pays and deductibles. I often get asked, when can people sign up for Medicare? And the answer is 3 months before their 65th birthday or within 3 months after their 65th birthday. So people just need to go to medicare.gov to do that, or call Medicare 1-800-MEDICARE, or they're welcome to reach out to the agencies that help with that. And of course, McKenzie's one of them. So 3 months before you're 65 and not more than 3 months after 65, one signs up for Part A. If you delay signing up for your Part A, you'll have a penalty. And that's also true for signing up for Part B. Part B has that premium. This year it was $170.10. And you can make a variety of plans with Medicare on how you want to pay that. You can write them a check every month. You can pay it by credit card. You can have a withdrawal from your bank, or you may have it deducted from your Social Security check. And signing up for Medicare Part B is not something a senior has to do if they're still working and they have credible insurance. As long as you have credible insurance and you have a letter from your employer that this is good insurance, you don't have to sign up and pay that Part B premium until you've decided that you've retired. And then you want to sign up for it. And then people all year round, if they don't have any health insurance, can sign up for Medicare, but that is income driven. So it depends on family size and income, but a single person making less than $19,000 a year should be able to sign up for Medicaid. And then it increases by family size, how much income that there can be. Are there any questions for me yet?
Thanks, Louise. Let me look. It looks like we don't have any questions in our Q&A quite yet, but if anyone would like to enter a question, there's a button at the bottom of your screen where you would enter those questions. I actually have a question. When you had been quoting the prices of $170 for the Part B, does that is that per individual? So like my husband and I both would pay 170?
That's correct.
Okay. So
Yes.
I wondered if there was a break if you were married. Okay.
No,
All
that's
right.
individual. One question that I sometimes get from people is, I've become disabled. When does my Medicare start? And Medicare doesn't kick in until 2 years after the onset of disability. But if you become disabled, you might be able to get COBRA insurance through your employer, or that is one of the special qualifying events to get onto Marketplace. The qualifying events that could let you get on Marketplace when it's not open enrollment, and right now it's open enrollment November 1st through December 15th, I think it is. You can sign up though when you have a special qualifying event at any time, and that's if you get married or divorced, you lose your job, which you would with disability, you have a change in immigration status, you're having a baby or you're adopting a baby, and so they're all special qualifying events.
Okay, great. So we do have a few questions that are coming in. The first question I see is, does the 170 cover Part A and Part B, or are there separate charges for each?
Most Americans qualify for Medicare Part A without any premium. It's based on your work history, and I've only met one individual that couldn't get Medicare Part A without paying a premium, and that premium's several $100s. The last I knew it was $468. But if you have that work record, there's no fee for signing up for Part A, but there is that premium for Part B.
Okay. So I do have someone, if I am pregnant, how can I get insurance?
Okay, most pregnant women in Michigan are Medicaid eligible, so they can just go to My Bridges or and apply for Medicaid. But Marketplace is also an option for pregnant women, and sometimes gals choose to go on Marketplace. So Marketplace or Medicaid when you become pregnant.
Okay. Here's one. My husband had to be admitted to a nursing home. How long will Medicare cover his care there? And is there any other help?
Okay. Excellent question. Medicare will never pay for more than 100 days in a row of nursing home care. And a person is not necessarily guaranteed 100 days. It depends on if you're progressing in therapy or your need to have skilled care. But after 100 days, then paying for nursing home care either becomes a private pay issue, and that can be very expensive, or applying for Medicaid. And more than 20 years ago, the federal government made up special spousal impoverishment rules. That means the community spouse shouldn't have to go to the poorhouse because their husband or their wife has to be in a nursing home. So more income is allowed to be kept, and so are more assets than ever before. If there's a community spouse and one in a nursing home, the community spouse can keep half of all income, not income, excuse me, half of all assets. So that's a considerable help. And then the allowance for income is more generous too.
Great. Is there any help to be able to pay for the Part B premium and the drug premium?
Yes, that's called extra help. And it also has odd little nicknames called Quimby and Slimby and even Allenby. Quimby stands for Qualified Medicare Beneficiary. And Medicare will pay for the Part B premium and the Part A and B deductibles, and Medicare co-payments, and give you a Medicaid card if, as a single person, you're making less than $1,133 and have less than $8,000 in the bank, or if you're a married person making a little bit less than $1,526 and having less than $12,000 in the bank. So there's help there. The SLMB stands for Specified Limited Medicare Beneficiary, and Medicaid will only pay the Part B premium, but you do get a Medicaid card once all of your Part B deductibles are met. And then Allenby stands for Additional Low-Income Medicaid Beneficiary. And because the income limits are so high there, it's only available while funding permits.
Okay, I see. Well, that looks like all the questions that we have for today. Was there anything else that you would like to add in?
I would like to talk about phone numbers for people to call if they have some follow-up questions. McKenzie Health System has teamed up with the Thumb Community Health Partnerships, and that covers all 4 counties. And the Thumb Community Health Partnerships encourage people to call. The time to get covered is now. So the Thumb Partnership can be reached at 810-895-2918, no matter where you live in the Thumb. Our Region 7 Area Agency on Aging maintains a Medicare Medicaid hotline. Fantastic number to call when you have any type of Medicare or Medicaid question. And I always love 1-800-Medicare because I can memorize that phone number, and you know, you're calling directly into Medicare and getting great information there. And then as a navigator for the Thumb Community Health Partnerships, people are welcome to contact me here at McKenzie Hospital as well. And my direct line is 648-6181.
Great. Thank you so much, Louise. That's all we have for today. I would like to thank everyone for attending, and this will be sent in an email to anyone that had been registered, as well as those that were unable to attend. Our next Healthy Lifestyle is going to be on November 16th at noon, and it will be Let the Snow Fall and Not You. So go ahead and get that registered, and we appreciate your attendance. Thanks so much.
I think our next class is on fall prevention, right?
Yes, Let the Snow Fall, Not You. Yep.
Okay, and Sandra Martin is one of our instructors for that. And right now she's teaching a Matter of Balance class at the Wesleyan Church in Croswell. And one of our participants is 96 years old.
Oh, that's wonderful.
It is. So there's still time to sign up for this Matter of Balance class, and you would just call McKenzie at 810-6486-117 to do that.
Perfect. That sounds great. Thanks so much.
Thank you, everyone.
Have a great day.
Bye.